Hello, you're welcome to my platform. I am Dr. Sandra and I am a surgeon. I hope you become aware and sensitized about the different surgical conditions. Today's video is about a congenital arteriovenous fistula. A congenital arteriovenous fistula is a condition that is present at birth and it is characterized by an abnormal connection between an artery and a vein. This abnormal connection between an artery and a vein results into a direct flow of blood from the artery to the vein. Normally, we should not have a direct flow of blood from the artery to the vein. Normally, blood that is containing oxygen and nutrients is pumped by the heart, and it flows from the left side of the heart, specifically the left chamber of the heart called the left ventricle, via the biggest artery of the body called the aorta. Now the aorta gives off branches called arteries, and so blood, which by the way at this level is under a lot of pressure, has to pass via the arteries, and now the arteries also give off some branches called arterioles, and so blood passes through these arterioles, and the arterioles take this blood to the smallest blood vessels of the body called the capillaries. At the level of the capillaries, there will be an exchange of substances. For example, the blood will give off its substances, for example, oxygen and the nutrients, to the cells of the body, and then the cells of the body will give up the carbon dioxide and the waste products, such that these are taken up by the blood and they will flow through the small veins called the venules and then into the bigger veins. Then the veins will take this blood containing carbon dioxide and the waste products back to the heart, specifically the right side of the heart, that is the right atrium, and then the right ventricle, and then back to the lungs via the pulmonary artery. At the level of the lungs, carbon dioxide will be eliminated and oxygen will be replenished into the blood. Now you can see that blood should not flow directly from the arteries to the veins. This normal arrangement of blood flow ensures that the blood pressure reduces as blood flows through the subsequent blood vessels. For example, the blood is at a very high pressure at the level of the arteries, and this blood pressure keeps on reducing as the blood flows through the arterioles and then the capillaries, and by the time it reaches the venules and the veins, the blood pressure has tremendously reduced. This is because these blood vessels are built differently. For example, the arteries are built in a way that they can withstand the pressure and the stress that comes with this blood that has been pumped by the heart. They are built in a way that they are thick-walled and they are elastic, they can expand. On the other hand, the veins are thin-walled and less elastic, they cannot easily expand. So you can see that if you have a direct flow of blood from the arteries to the veins are ill-equipped to handle the stress and pressure under which this blood is at, because they are thin-walled and less elastic. They are not strong enough. In a setting of the congenital arteriovenous fistula, blood does not reach the level of the capillaries. So this means blood flows directly from the arteries to the veins. And remember that the veins are thin-walled and less elastic, so they are ill-equipped to handle the stress and the high blood pressure that comes with this blood. when there is a direct connection between the artery and the vein, as in the setting of the congenital arteriovenous fistula, the veins tend to undergo some changes in order to withstand the pressure and stress that comes with this blood coming from the arteries. So they will transition from being thin-walled and less elastic to being thick-walled, tortuous and dilated. So they will tend to mimic the qualities of the arteries. Unfortunately, at some point, the veins will not be able to expand any further because they are not built to expand as much as the arteries expand. And so they might rupture, and then the patient can bleed a lot. The sites that are commonly affected by the congenital arteriovenous fistulas include the upper and the lower limbs. It can affect the entire limb, or it can affect part of the limb, for example, the toes and the fingers. It can also affect the brain, the lungs, as well as other organs of the body, for example, the intestines and the urinary bladder. The signs and symptoms of the congenital arteriovenous fistula are dependent on the site of the body that has been affected. For example, in a setting where the condition affected the superficial parts of the body, for example, the upper limbs and the lower limbs, there is going to be a lesion that is characterized by prominent, thickened, dilated, tortuous veins, and this lesion will be warm to touch. There will also be a thrill. A thrill is a sensation of vibrations arising from the lesion, especially when you touch the lesion. So when you touch the lesion, you feel like there are some vibrations arising from this lesion. The affected limb will be longer, warmer and bigger than the opposite limb. The affected limb will be painful and heavier than the normal limb. There might also be an ulcer in areas that are below the lesion. For example, if the lesion is on the thigh, the ulcer might be on the leg or the foot. There will also be some presentations of the congenital arteriovenous fistula that are best detected by the health workers. For example, there will be a bruit and a machinery murmur, and this will be heard by the health workers using a stethoscope. There will also be an increase in the heart rate, a low diastolic blood pressure and a high systolic blood pressure, a wide pulse rate, and a Nicola-Doni sign. So these presentations will be reported to you by your doctor if you have a lesion of this caliber on your body. If the congenital arteriovenous fistula is affecting the brain, the affected individuals are going to present with headaches, seizures, weakness of the muscles of the face, the upper limbs and the lower limbs, vision changes or vision problems, memory loss, inability to speak, loss of balance, decreased sensations, among other things that might point to a possibility of an abnormality in the brain. If the congenital arteriovenous fistula is affecting the lungs, the affected individuals are going to present with coughing blood. If the congenital arteriovenous fistula is affecting the intestines and the liver, the affected individuals are going to present with vomiting blood and passing dark colored stools. If the congenital arteriovenous fistula is affecting the urinary bladder, the affected individuals are going to present with blood in urine. The investigations that we carry out in the congenital arteriovenous fistula include a magnetic resonance angiogram. We can also carry out a Doppler ultrasound scan, a CT angiogram, X-ray of the affected area. We can also do ECG and echo. All these investigations are done to diagnose the congenital arteriovenous fistula or to look out for the complications that have arose as a result of this condition. The complications that can arise from the congenital arteriovenous fistula include massive bleeding, clot formation, as well as congestive cardiac failure. So that means that your heart can easily fail as a result of the congenital arteriovenous fistula. When it comes to the treatment of the congenital arteriovenous fistula, we recommend early intervention such that we can avoid these complications, for example, bleeding, clot formation, and cardiac failure, because these complications are life-threatening. The patients can easily lose their lives if intervention is not done on time. The treatment modalities include endovascular procedures, or what we also call the catheter-based procedures. We can employ stenting and coils to make sure that we occlude the fistula. We can also use cyanoacrylate glue to make sure that we occlude the fistula such that there is no direct flow of blood from the artery to the vein. We can also employ a procedure called embolization. Embolization is a procedure that employs certain particles, for example, beads and sponges, that occlude the fistula such that we prevent a direct flow of blood from the artery to the vein. We can also employ radiotherapy. Radiotherapy causes scar formation in the fistula such that we don't have a direct flow of blood from the artery to the vein. There are severe cases where the congenital arteriovenous fistula is affecting the entire limb. So in that setting, the only option we have left is amputation, that is the removal of that limb. So the limb is cut off. The take-home message is congenital arteriovenous fistulas can predispose to life-threatening complications, for example, blood clotting, massive bleeding, and congestive cardiac failure. So this means that early intervention is key in preventing these complications. So please be on the lookout for the signs and symptoms that I talked about earlier, such that you can present to the hospital for assessment, investigations, and subsequent surgical intervention, because this can prevent the complications that can arise from delayed intervention. And if you happen to have the congenital arteriovenous fistula affecting the superficial parts of your body, for example, the upper limb and the lower limbs, please avoid trauma to your body, because this can predispose it to massive bleeding. You have to be aware of your environment. Please take the necessary precautions to avoid trauma to your body. Yes, that is what I had for you. Thank you so much for listening to me. Please share my videos and also subscribe. See you in my next video. Bye.